Hi there and good afternoon, everyone. It is now noon, so we're going to go ahead and get started. I am Helen Hockey, the Executive Director for the Pennsylvania Coalition for Oral Health, and we are so glad that you have joined us today. Some of you may be over your lunch, some of you hopefully on a day off. We understand that it is often difficult to make a trip to an in-person meeting, so we're really happy to offer these brief updates twice a year to share some work that we've been doing and potential pieces of collaboration that we hope you can join with us in accomplishing our goals. So as always, this meeting will be recorded and shared on our YouTube channel, so you can share the link or view anything after today. Just a little bit of housekeeping as we get started. Everyone's pretty good at Zoom now, but since we are in a webinar, all lines have been muted by us, which will keep all the background noise to a minimum. Any questions that you have during our time together, please type them in right into the Q&A box, which should be at the bottom of your screen. And you can do that at any time during the presentation. We may be able to grab some of them throughout, but if not, we're going to answer them during our Q&A time at the end. And for anybody who is possibly joining us by phone or might not be able to see the slides right now, I would encourage you to definitely go back and review the recording at a later time. And we are also going to send a link out for the presentation directly to everyone who participates today. So you'll have the slides by themselves and along with a PDF of all the slides, because we do have a lot of links built into our slides. So we want to make sure that you guys have access to those resources at a later time. So with that, I'm going to take just a minute to talk a little bit about what PCOH is and what we do, since we've got some new folks with us today. Many states across the country have developed oral health coalitions over the last 20 years, and a handful of them have had them even longer. And what an oral health coalition does is it doesn't center around a certain type of health provider or a specific policy goal, but more of a broad spectrum collection of groups and individuals who are all really passionate about oral health. And so we help them share ideas and work together, and then play a little bit of a role in initiating new projects and programs ourselves. So Pennsylvania is part of the American Network of Oral Health Coalitions, which is a national network of similar groups. So what that means is that we can often reach out to other states and borrow from their programs and ideas. Our coalition was incorporated in 2016. That's when we added staff and a more formal board structure. We are a registered nonprofit with the state, and we rely on grants and donations to do most of our work. So, in just 5 or 6 years since incorporating, we have nearly 1,000 individual and organizational stakeholders across the Commonwealth. So every time we add a stakeholder, their background sort of helps to contribute to our reach and our knowledge base. And that makes me in particular extremely grateful. So the connections that we're able to make around the state mean that no one has to recreate the wheel. So we learn from each other. And I don't know about you guys, but I absolutely love stealing people's good ideas because imitation is the highest form of flattery, right? So that is what we love to do. To start us off this afternoon, I'd like to invite our board chairperson, Lisa Davis, to say just a few words of welcome to everyone. Hi, Lisa.
Hello, Helen. Thank you, everyone, so very much for spending this hour with us. I have been absolutely privileged to serve as the chair of the board of directors of the coalition for this year. I've worked with the coalition for many years and have tremendous respect for the work that the coalition has done and for the role that it has played here in Pennsylvania on advancing oral health in all types of communities and all types of geographies. And also the way that this coalition leads many of the coalitions across the country. So we are, I would say, one of the most robust and most active coalitions. And much of that is due to Helen and the team at PCOH and also to the members of the board of directors. This has been a great year for PCOH, an absolutely great year. Not only has the coalition seen an increase of funding and an increase in projects, they have also expanded their staff. We've added new board members, and in January, the coalition will be launching its strategic plan to look at the ways in which the coalition over the next 3 years will be advancing oral health in the state. So I can certainly say that over my time with the coalition, and certainly within this past year, the coalition has received a lot of support across the state, a lot of recognition, and its credibility and visibility has done nothing but increase. So Helen, congratulations to you. Congratulations to the staff for all of the hard work, and my thanks to the board, to the members of the board of directors. Thank you.
Thank you, Lisa. PCOH has been so very lucky to have such a wonderful chairperson. And as Lisa's term comes to a close, we're really excited that we get to hang on to her as a board member, and we're glad that she's also going to get a little bit of time back in her life and not have to deal with my constant calls and emails. So for those, as we move on here, for those who've been working with PCOH and participating with PCOH for a while, we're going to go through just a couple slides that will seem pretty familiar to you, but we have a handful of new folks today, so I do want to just spend a minute with some background on the coalition, and we're also going to talk a little bit about our staff. So when you attend a PCOH event or you reach out to us about an issue or a concern, the folks on the screen are who you're going to be talking to, and we're really, really fortunate to have brought on some new staff this year, and I want to take a minute to have all of our staff come on camera and just say hello. Many of you know Amy Tice and I very well, and we've been with the coalition for a number of years. Of course, we're always available if you have any questions or concerns, but I do want to take a minute just to have our newer staff come on camera to say hello. So first up, I'm going to ask Nicole to do a quick intro. Hi there, Nicole.
Thank you very much, Helen. I am Nicole Payonk. I am the Policy and Advocacy Coordinator for PCOH. I joined the coalition in September, and I'm very excited to be here. Just a brief background on what I did before joining PCOH. I have a background working with at-risk populations in varied settings, as well as a lot of coordinating responsibilities relating to physicians and primary care physician education.
Thank you, Nicole. And next, I'm going to move to Leah.
Hi, I'm Leah Benishai. I joined the coalition at the very end of September. I have a background in nonprofit project coordination and public health. I'm new to the oral health world, but I am finding myself more and more passionate about it every day. So thanks for welcoming me in.
Thank you, Leah. Pat, I will say oral health gets under your skin and you love it forever once you're in. So, and last but certainly not least, I will go to Allison here.
Hi, I'm Allison Fiza. Thanks, Helen. I joined the coalition in October through the CDC Public Health Associate Program, as also known as PHAP, and at PCOH, I'll be our Data and Evaluation Associate. I come from a more environmental background. I studied chemistry in school and also came from the Washington State Department of Health and the newborn screening laboratory side. We're really excited to be part of PCOH and improve our data.
Thank you guys so much. As you can see, we're really, really lucky. We've got some great new faces with a lot of really diverse backgrounds. And so I think that that's going to help kind of propel us forward for 2023. And I also always mention at this time too, that we do rely on a number of students and interns throughout the year. So if you're out there and you have students that you work with or someone who might be interested in oral health projects, we're always willing to have that conversation. We've been working with a wonderful student, Jackie, that's been with us for the last semester or two working on school health. And because we rely on volunteers and interns to stretch our resources further, it's always very much appreciated. So now let's talk a little bit more. I'm going to go ahead and move our slides forward here to talk a little bit more about the work that we're doing. Hopefully, this will all be very interesting to everyone. If you've been around a while, you know these are pretty familiar. These are our 4 priorities that we work with. Of course, you know, workforce is a big deal. It has probably never been more relevant than it is right now. So we're going to talk a little bit more about that. Looking at policy and ways that we can infuse oral health into policy that's either already existing or is being developed for the state. And then, of course, we look at populations that maybe don't have equal access or equitable access to oral health services and what we can do to bring more equity into the conversations there. And then lastly, but definitely again, not least, our community water fluoridation efforts. We'll talk a little bit more about that on some of the slides coming up. So as we talk a little bit about what we're taking on in 2023, I do want to just point out something I love to share with folks is that, you know, some of the things we talk about is, you know, our work pieces that are done internally by PCOH staff, PCOH board members, committees, but almost everything we do is really, really collaborative. So, you know, we're working to improve oral health in the state, and, you know, we share some updates of what's going on, but we want to make sure that everyone understands that you can play a part in this, right? So whether it's a tiny little part or it's a huge part, if you hear of something going on that interests you and you want to be involved, or if you're doing something really cool and you want to tell us about it, those are things that we love to hear. So checking with a staff member, you know, ask if you want to be more involved with a work group or a task force. And we're happy to include everyone that we can, because that's how we're stronger. So before we get into the work we're going to do this year, just one final slide, just to, of course, extend our sincere thanks to say how fortunate we are to have a really wide variety of support from a lot of corporate and community funders. So as I mentioned earlier, we are a registered 501c3 nonprofit, and you know, every year about 85% of our dollars go directly to programs in our state. So we take that role very seriously. We want to make sure that we are doing right by all of our donors. And, you know, we do use a lot of federal and community grants as well. So the reliance on all of the donors you see here is really helpful for us to just keep the doors open and keep moving forward and to be able to build the capacity to have new projects. So many of our funders have been giving us annual support for many years. We really could not do the work without them. And, you know, you see some big names on the slide. But I also want to point out that we have a lot of individual and smaller organizational donors that also give, and some of them give financially, and some of them give their time, and some of them give their expertise, and we'll take all of it. We're really not picky, so we just really sincerely thank everyone for really everything that you've all done for keeping us going and building us up to the strong coalition that we are today. So, and of course, we run an annual fundraising appeal like every nonprofit in the world. So at the close of the calendar year, we always ask if somebody is interested in kind of keeping us in their donation dollars for the year. We are really, you know, pleased to be able to assist with that. And many of you probably have received a little flyer in the last week or so with a little gift from us. So if you didn't get one, it may mean that we don't have a physical mailing address for you. So we can update that ASAP if you let us know at info@paoralhealth.org. And thank you to all of those who continue to support our work, so both financially and through your passion for oral health. So it's really, really helpful. So to talk a little more about our work, this is the important part. So I loved this graphic, and I just had to share it with you all. You know, we saw 2022 saw us kind of come back to a more normal return to the way we worked previously or pre-pandemic. Coalitions, of course, work best by communicating, right? So that's our job. We connect people, we communicate with people, we share data, we share stories. And Zoom is wonderful for that. We've been using Zoom for 6 years. So Many of you have heard me say we were Zoom before Zoom was cool, but it isn't a complete replacement for in-person touches. So it was super exciting to see 2022 be a year where we were able to return to a more, normal, we don't use that word anymore, I don't think, but pre-COVID environment, and to kind of get back to some travel and in-person meetings. And that's allowed us to do more for the greater good. So, to start off by saying it's been wonderful to see that happen and to be able to see a little bit of that return. And we're going to start today talking, these of course are some real high level issues. When I was thinking about today's slides, I feel like sometimes we backtrack so much and we want to explain why we know things, and that's true. But, there are some kind of basic core concepts that, we know kind of set the stage for how we move forward. And so when we look at these things, you can see I've mentioned a couple things around workforce and health equity, water fluoridation, and champions. So if we talk about, if you've tried to make a dental appointment lately, right, workforce is an issue. We're hearing a lot of information, and we'll talk more about that in a bit. But we don't really have to defend the idea anymore that workforce is an issue for dental. Same thing with our health equity. So we've got a lot of factors that determine whether or not you have access to oral health care. So whether it's geography, whether it's disability status, income, race, ethnicity, insurance, there are a lot of things that sort of say, hey, you don't have the same access that others do. And our role and what we see as a really important part of our work is to balance that. The third piece in terms of water fluoridation as a population health measure, there's nothing better out there than community water fluoridation to help people be healthier. So, it continues to be a high priority for us. And then lastly, when we talk about, we look at patient advocates, we look up to state level folks, we look at federal policy changes, all of these pieces, right, can kind of contribute to the oral health environment. So what we're trying to do is work and make connections across the board. So we need champions at every level. So, no matter who you are, what your work background is, what you do now, we need you to be an oral health advocate. So I hope you see your part in the work that we're doing as we move forward. And as many of you know, for some of these webinars, most of these webinars, we typically walk through our priorities and give some updates on each. And I wanted to do a little something different today to talk a little bit more about our work groups or task forces of PCOH. A lot of that touches our priorities, of course, but it might give you a slightly different perspective than maybe you've had in the past. So these are our main non-board committees that we work through at PCOH. So we're going to tackle each one of these a little bit today, and give you not only some of the work we've done this year, but also the challenges we're facing, and then the work we're looking forward to in 2023. And at the end of our time together, hopefully you'll have a better understanding of all those different pieces. But before we get to that work, of course, I have to mention our state oral health plan. As many of you know, we work as a sole source contractor under the Pennsylvania Department of Health Oral Health Program. And part of that work is helping them to develop and implement our state oral health plan. So we're not going to specifically talk about the health plan today, but if it's a new document to you, you haven't seen it before, reviewed it, it's a short one, it's only like 20 pages. There will be a live link on the slides that are sent out. You can click, go right to it and check it out. And we are going to be, we always use that work as a framework for how we, decide what tasks to take on. So we will be mentioning a few of the measurable outcomes of the plan today as we walk through the work of 2022. So I wanted to start with community water fluoridation today, and I feel like I always save that for the end. And so today we kind of shook things up and decided to start with community water fluoridation instead. We really focused a lot on our communication around CWF, as we call it, in 2022. So as oral health advocates, which I know you all are, you wouldn't be on this call, we know that community water fluoridation is safe and effective, and it has been for almost 78 years. So we're coming up on 78 years. But there's a lot of misunderstanding that takes place around community water fluoridation, and it leads to communities suffering because they don't have the same access that others do. And one of the biggest successes I wanted to point out this year is sort of our renewed partnership with Dr. Denise Johnson, who's the Pennsylvania Physician General and Acting Secretary of Health. Many of you may remember Dr. Johnson's advocacy in Meadville back as her hometown when she initiated and helped to initiate fluoridation there. And we've been really fortunate to see that sort of high-level buy-in, right, to the community water fluoridation as an effective population health measure. We've also continued our usual activities of going to water operator conferences, association conferences, talking to folks that are directly doing the work of optimally fluoridating water. So we attend, we exhibit, we establish and build relationships with them, with the ultimate goal of, thanking them for their work and making sure that if they run into trouble, that they're able to come to us as a resource. So, we continue to do that with 4 different organizations across the state. And then lastly, we did some additional trainings and events this year, which, we were really excited about. We didn't set out to have so many, but there's been a lot of renewed interest, and it just kind of worked out that way. So we've been trying to bolster support at the community level for community water fluoridation. So we held a statewide advocacy training in Harrisburg in July. We were fortunate enough to partner with the American Fluoridation Society for that. And then we had an even more specialized event in October for pediatricians, because we know that, our medical providers are also frontline in water fluoridation advocacy. And then the final 2 events I wanted to mention, we held 2 separate Water for Health events that one was in Westmoreland County, one was in York County. And we targeted those counties since they hold 2 of the largest systems in the state that are not adjusting the fluoride in the water. And we modeled these events after a similar one that was held in Berks County back in 2019. And all community members were invited to attend. And it was really a presentation that wasn't just focused on oral health, but we brought in the local water systems and state level agencies to talk more about the benefits of safe, clean tap water, right? So, fluoridating water doesn't help if nobody's drinking it. So we want to make sure that people see the importance of drinking tap water and why that actually is the most beneficial for their health. Now, challenges, in spite of all that good work, we thought we were doing really, really well there. But we have struggled this year with some local communities debating on retention of their fluoride programs. So in our state, if you're curious as to if your water is fluoridated, maybe you don't know, again, on the slides coming out, you'll have a link there at the top that you can click on. We have a fluoride map, so people can see if their water system is fluoridated or not based on their address. We have over 2,000 water systems in the state. And I always like to share with folks that over 1,200 of those systems serve less than 1,000 people. So lots of really, really, really tiny systems, okay? Which makes it hard to do advocacy for something like community water fluoridation, because that's a lot of conversations to have. At this point in our state, we're sitting around 55% of our residents that get their water from a community water system having the benefit of optimally fluoridated water. So that's something that we don't think that's a very good number when we compare that to the Healthy People 2030 goals set by the Surgeon General, which we know is over 77%. Our 55% is a little bit pitiful. So we really want to see that number go up, and we're fortunate enough to have a state CDC grant that helps us do some of that promotion. Now, despite our best efforts, we did have 5 different water systems this year that either decided to discontinue their fluoridation or are debating whether or not they should discontinue their fluoridation program. So we've worked with each of those. We've connected them with the Department of Health, the CDC, the American Fluoridation Society, the Dental Association. We're really, really trying to increase that communication and really go a little bit more to the offense side of defending community water fluoridation. So what are we going to do next year about that? How are we going to do this? So these are some of our ideas. Some of them are more fleshed out than others. But we really have found that something as simple as, and it sounds silly to call it that, but a thank you campaign. So of those on the call, if your water system does optimally fluoridate your water, how many of you have ever called the water system and said thank you or sent them a card? Holidays are a great time to do that, just to say, hey, I appreciate what you do for me every day in protecting my oral health. So we'd like to build that out into a more robust program and target some of the communities that have the larger water systems. So that's something that we think will be more beneficial than some of the other communication techniques that we've tried. Definitely more offense. Right now, we're kind of putting up a lot of defense as communities change their mind or hold meetings on water fluoridation. We feel like we're constantly just defending the practice. So now we want to go a little more on the offense and get it out there to promote. So we'll continue to offer our water system equipment grants. So if your water system is struggling to get new equipment for fluoridating, or if your system doesn't fluoridate but would like to, we do have grants available to help offset those costs. And we'll continue to work with our water operators, looking at, of course, the same organizational conferences that we attend. And we want to really target the systems we want to protect. So of those 2,000 water systems I mentioned, about 180 of them adjust the fluoride content in the water to an optimal level. So those are the ones we really want to talk to, and we want to make sure we're working with them specifically to retain that water fluoridation. And then lastly, we want to make sure that our water operators feel comfortable with water fluoridation, and we'd like to kind of reward them for learning more about it. So we're in the process of setting up an accreditation for a course that's offered by CDC to teach water operators about water fluoridation. So our next work group I'm going to touch briefly on is our school-based oral health program and school-based sealant programs work group, which some of this work kind of falls under that. Some of this work is a little outside of that, but I thought it was a great place to put it. Probably a lot of you have heard us talk about our basic screening survey that we did this year. We finished up at the end of the school year in early 2022, and it was a state-sponsored survey funded through the CDC to look at third graders in our state and try to take a representative sample of the disease status. So how many have cavities, how many have untreated cavities, how many have sealants, and how many have an urgent dental need. So we were able to roll that out with 12 different screeners this past year. We screened over 4,000 students at 77 elementary schools. It was quite an endeavor, especially during a lot of COVID undecidedness. But we were really pleased that we got that done. Now, that being said, the data are now with the Department of Health, and those are going to be analyzed, and we'll be able to deliver some outcomes and information next year about that. So I'm really, really excited. I'm kind of jumping into the 2023 piece, but just have to say that because we're really excited about it. The other thing that we talk about a lot with school-based programs is our school sealant programs that we help the Department of Health manage. Those are either certified school dental hygienists or county health departments or federally qualified health centers that go out into the communities, into schools, and provide sealants, and then report their data back as part of a state program. So, and of course, you'll have links on all of these. You can see some of the data there. But our goal really for part of the work with the Department of Health was that in a 5-year period, starting in 2020, we wanted to have 5,000 kids receive dental sealants. So in the first 2 years, even through a pandemic, we've been able to see over 1,200 kids. So that's a pretty good success, and we want to continue that. And if you work for a program that maybe does something similar, you want to learn more, we're always willing to add more folks to our task force. We've got about 40 different individuals and organizations on our task force, so we're really excited to build that up. Now, just in terms of challenges with school-based programs, we have 500 school districts in Pennsylvania, so that's a lot compared to other states. And so that means every district makes its own decisions and kind of does its own thing in a lot of ways, which can be hard to collaborate with. Now, in our state, we have 28 of those districts with a dental hygiene services program, which means they have a school hygienist on staff as an employee of the school district, who not only does mandated screenings for the kids, but also helps to connect them to a dental home and provide classroom-based education. So one of the things that we'd like to see is more of those programs. Over the last few years, we've lost numbers, and so that's a challenge. We want to see those numbers go back up. We know that programs that have a school hygienist have about twice as many kids getting their dental treatment done. So that's a big deal. So we need to encourage those programs to stick around. And then when we look just strictly at the schools in our state, there are over 800 that the CDC would determine as high need schools, meaning they have greater than a 50% low income base. So, we have a lot of places to go there. Right now we're on track, hopefully, heading into 2023, that we will see at least, hopefully, 120 of those schools that will have one of our programs doing a school-based sealant program with them. We're also working and hoping to work more with our Pennsylvania School-Based Health Alliance. So if you guys aren't familiar, there's a National School-Based Health Alliance, and they work with school-based health centers, which are, health centers or clinics located directly in a school. Sometimes they serve the community, they have a separate entrance, and we want to see more of those centers offering dental services, and then we want to see more of those centers overall. So we'd like to kind of strengthen up that partnership a bit, adding more schools, of course, to our school sealant program, looking at our mandated screening programs that we have in the state. So, as most of you probably know, in our state, we're required to do screenings upon entry into school, which is either kindergarten or first grade, as well as in third grade and seventh grade. And so we'd like to see, that's a great program, but what are we doing with the data and how are we using it to better the program? So those are the pieces we're going to dive into a little bit more in 2023. And then how we get those screenings done from a policy standpoint. There was a bill introduced last session, feels strange to say last session and not this session, that House Bill 2332 that focused on allowing our public health dental hygiene practitioners to complete those mandated screenings, because some of our districts are having a really hard time finding dentists to do that. So we intend to keep pursuing that and hopefully bring that back next session in January. And, also then having the conversations with the schools that don't have that hygienist on staff to say, hey, this is a really cool idea and a cool model, and the benefit that to your kids could be, just amazing. So those are sort of the pieces we're going to be working on around school-based work next year. And then our third work group here, our Medicaid advocacy work group, again, just a quick touch on things that we did in 2022. We really focused on three things. So we focused on the health choices changes to the Medicaid plans. So our state recontracted out with the health choices providers, so the managed care organizations that provide benefits to our Medicaid members. And we wanted to do a focus on the dental side of that. So we developed materials for providers and for members to kind of explain that. They're live linked on the slides, so you'll be able to grab them. And we also have decided, sort of the second thing we focused on were the improvements to our current adult benefits. So we have a group that meets monthly to talk about this and work on this. And we were fortunate enough, again, live linked medical assistance bulletins there, to see some services added to our adult benefits this year, even a periodontal code. So for those that are from the dental world, we were really excited to see D4346 added to the Medicaid fee schedule. And it's a start, it's a step in the right direction for adults. And we saw some teledentistry preventive services added as well. So there's more information there on those links. And then, of course, lastly, was really looking at how we develop relationship with legislators to move policy forward. So we've had numerous calls with our Department of Human Services. We've looked at data. We've talked with everybody. We even went to Harrisburg in October to hold meetings and talk a little bit about the work that needs done there. So where our challenges are, and probably none of this is new to you if you work in this space at all, we've got a lot of geographic disparities in our state. Rural is struggling. So there was a bill introduced in 2021, HR 68, which asked our state's Legislative Budget and Finance Committee to do a study on oral health access in rural areas to see if there have been some issues there. So PCOH has been serving as the lead stakeholder with that group on the report, so sharing a lot of data. And that's actually going to be coming out in January. So kind of a tie-in to the work we're doing next year. But just to say it's a challenge, we know it's a challenge and it's being addressed. Our fee schedules, of course, are still low. That's always a problem when we talk with providers. Our number of participating providers with Medicaid really has not changed. We've been sitting at 23% of general dentists for the last 10 years that participate in Medicaid, which is an abysmally low number. And that doesn't mean that those folks are also taking new patients, or taking all of the MCOs. So that number drops quickly when we start applying those other aspects. So our shortages, so everyone's experiencing dental shortages right now, workforce-wise. They are definitely exacerbated in the Medicaid situation. So, many dentists decided post-COVID to drop participation with Medicaid. And we know that, some areas of the state, we saw up to a 25% drop. So really, really big problem there, and something we've got to address. So we, and we'll talk a little bit more about workforce, but we do have some information coming out in January that's going to talk a little bit about that. What we can do. We were able to work with Dr. Sean Boynes and complete a secret shopper survey of over 1,200 different dental offices in the state and gather some data. And what we saw was that disparities in Medicaid were worse, of course, than what we're seeing for non-Medicaid families, which was no big surprise, but definitely an identified challenge. So what we're going to work on next is taking that study I mentioned, putting it into action, right? So that study is going to come out. It's going to have policy recommendations. We're going to take that and run with it. We want to make sure that every legislator knows what part they can play in fixing the problem. So we're going to be having an advocacy day in the spring. If you want to attend, everyone is welcome. If you work with students and you want them to come, we're really, really excited about that. We'll continue to push DHS to add services to the fee schedule. And then we've started conversations with Governor-elect Shapiro. But what we would really like to see is to have dollars put back into the Medicaid program for the comprehensive list of adult benefits that we had prior to 2011. And so we're hopeful that we could see that reflected in the governor's original budget. If not, we'll continue to work to try to get it in other ways. So super excited about that and the opportunity that presents. We are going to work our teledentistry bill that was in last session, did not kind of make any progress through last session. So we'd like to see that reintroduced so that we can define teledentistry, which will increase access for a lot of folks in our state. And then also looking at our schools in our state, those 500 school districts that some of them actually do have dental clinicians on staff, are not able to bill Medicaid for those services. And so it's really hard to justify a full-time position in a school budget if there's no income coming in from that. So we'd love to be able to see schools able to bill Medicaid directly for services that are provided by a certified school dental hygienist. And so that's something that we're investigating and hoping will help the Medicaid population in particular as we move forward into 2023. So our fourth task force / work group is our Family Oral Health Collective group. And many of you are familiar with that group. We work with the Pennsylvania Association or Pennsylvania Association of Community Health Centers, the PA chapter of the American Academy of Pediatrics, the Pennsylvania Office of Rural Health, and the Pennsylvania Head Start Association, and us and some others as well, but a big, wonderful group that's been working together for years. And we focus on oral health literacy, particularly for young kids, but really all the way through the lifespan. So, and, you know, we've also got some kind of side projects that go along with that work around education and helping people. So our FOHC group does a lot of literacy materials. You can see one of our flyers there. And then we have some partnerships. You know, what's lovely is all of those different groups are able to go out and spread our information and our materials to others. We work under two separate grants, one for tobacco and nicotine cessation, as well as one for HPV vaccine promotion, so that we can get people healthier by taking those preventive measures. I will mention, you know, we've been doing a lot around HPV, and that seems to have sort of a lot of groundswell with it. So we'll talk a little bit about that on some of these subsequent slides as well. So challenges that we run into with this, when we talk about who's out there talking with people and increasing oral health literacy, looking at our community health workers, that's a really big piece of it. If you're not familiar with community health workers, those are people who serve as a liaison between a community and the healthcare community. So sometimes we have levels of distrust between a community member and what a provider who may not look like them or talk like them says. And so community health workers are vital for kind of providing that link and helping navigate the system. So whether it's transportation, whether it's appointment setting, whether it's insurance choosing, all of those things kind of fall under the purview of our community health workers. And so these are, you know, boots on the ground, working directly with people who need help. And we want to try to support them and make sure that they're also familiar with oral health priorities and what they can do to help the populations they're serving. So right now, that's not a required training for all of the different programs that train community health workers. So we want to make sure that we work towards that. Another piece that we will be, you know, sort of seeing as a challenge that we need to work on is that with our school programs, sometimes the mobile dental units that come in are not always tied to a brick and mortar dental home. And so we see some issues where, you know, that doesn't always work as helping kids get to complete care. And so we kind of want to watch those and kind of address that as a challenge. We were able to work with the chapter for the American Academy of Pediatrics to look at the Early and Periodic Screening Diagnostic and Treatment Schedule, EPSDT, to see when kids are being referred for dental appointments from their medical provider. So they did some changes to the schedule about a year or so ago, and didn't exactly omit the referral to the dental provider, but made it harder to see. And so we're really grateful to the AAP for working through that with the state and getting some information put back in, because we need pediatricians referring at age 1 and making sure that their patients get to the dental home. And then we're also looking at sort of the long-term, we're seeing a lot of places, organizations have had some recovery kind of in this post-pandemic world. But our Head Start kids are still struggling a bit. We're not seeing those numbers rebound quite as quickly. So we want to make sure that those, you know, early learning centers and Head Start programs are equipped to be able to get their numbers back up to pre-pandemic levels. And then, of course, our safety net clinics. So when we look at federally qualified health centers and rural health clinics, they're really hopelessly overwhelmed right now, and our free and charitable clinics. And, you know, we want to make sure that, you know, right now they're being extremely challenged. For some of them, they're the only Medicaid providers left in their community, and they're getting a lot of phone calls. So that's a challenge that we want to take on and try to help those folks as much as we can. So, If you're not familiar, I did want to mention PCOH has a lovely request materials page. So you're able to go and pull down resources on a variety of subjects. You can request them. We will send them to you. Some beautiful posters and rack cards and flyers and a little bit of everything that you could ever possibly need. And if there's something that's missing there, maybe ask us. We may know of other resources. So if you're looking for, you want to share information on HPV or nicotine cessation or community water fluoridation, we have materials available on those pages for you to request. What we would also like to do is to become a continuing education provider for those community health workers. So we can at least ensure that our CHWs are getting continuing education. So once they've already been certified, they have to take Con Ed. And we'd like to be able to offer oral health courses as part of that work. Looking at our medical offices, our fluoride varnish applications by pediatricians, continuing to focus on medical providers, again, really, really important. I mentioned the Head Start piece already, and the work with our health centers to make sure that they're out there able to serve as efficiently as possible for the people who have dental needs. The basic screening survey, as I mentioned, we're going to be using those data moving into 2023 to talk a little bit about the burden of dental disease on kids. We'll continue to run our tobacco and nicotine cessation training. So if you work with dental providers and you're interested in either online or in-person training for that kind of work, we can help you with that. And then our HPV work, we have a dental provider toolkit available so that dental providers can be comfortable talking about HPV and the HPV vaccine. And then also a course is available on our website. We'll continue to promote for dental providers to learn a little bit more about HPV. So our last piece, the oral health workforce work group, a couple things that we're proud to accomplish this year. I think the biggest thing, I always hate quantifying these things, but I think the biggest thing that we did this year was to put out the Access to Oral Health Workforce Report, our Part 1 version. So big thank you to Dr. Sean Boynes and Kelly Braun from the Office of Oral Health and our entire authorship and review teams. We were able to dig into the workforce issues a little bit more on a state-specific level and come up with, there's some regional assessments if you want to see how your state's looking, some recommendations. And so that's a really big deal for us. So that's a live link. You can click and read that whole report. We continue to work with high schools to build up their programs around supporting dental careers. And so we were able to update and publish all of the program listings for the different dental careers. So a list of the dental schools, the dental hygiene programs, dental assisting programs, expanded function programs. Those are all available on our website, so you can check those out. And of course, we continue to go to all of our State Board of Dentistry meetings, offer public comment as necessary. And the one thing I wanted to mention was probably a lot of you from the dental community saw that Senator Scott Martin's bill, SB 1173, did pass and was signed into law, which will allow dental providers to get continuing education credits for their volunteer time. So, we take that very seriously. We know a lot of dental providers volunteer time for the public health populations. And so that's a great win for us. So our challenges, and I pulled some of this directly from our workforce report, we're seeing that our overall dental workforce has decreased about 10% since 2015. And then we actually lost providers faster during COVID. So we knew that was a big problem. We're also looking at, where we can build up the workforce training programs that are out there so that we make sure, we have enough dental providers per county, because right now we do not in many of our counties. And so the community impact of what that looks like, right? So as our workforce goes down because of retirements or leaving the workforce, we also feel that in our communities because it's lost revenue. So you see tax revenue go down, you see labor income go down, and all of a sudden communities are not doing as well. The limiting capacity is referring more to our dental hygienists and assistants that have certifications not being fully utilized to their highest level scope of practice. So we want to make sure that we are using the staff that we have to use better. And that's kind of across the board in the dental community. And then lastly, Pennsylvania actually ranks pretty close to the bottom nationally for annual salaries of dental providers. So we know that we're a big state and we know that we have a high population. So it's really, really important that we treat our providers well so that they stick around and don't leave the dental workforce. So we're going to have a second report coming out next month. I guess that is next month now. That's going to dive a little bit deeper into some of those problems. We'll give some information on that secret shopper survey that I mentioned. So we're going to be using those recommendations to kind of inform our work through 2023. We also want to look at what it could take in our state to formalize a dental assistant certification. I know that's a big lift and many of you may have just had your jaws hit the floor, but we really feel strongly that dental assistants need to be recognized with a certification in order to really see the value in their work and to make sure that we keep them in the workforce. So we're going to start doing some preliminary investigations there. Also working with our high school programs. So we've got a lot of technology programs in the state that are driving people towards dental careers. So we want to take full advantage of that. And we have a work group, a community of practice that's going to be meeting regularly to sort of investigate all of these pieces. And that's a wonderful partnership with the Area Health Education Centers, the Association of Community Health Centers, PACT, and as well as the Office of Rural Health. So those groups are, going to work with us so that we can make sure we're really fully investigating these workforce issues and putting some solutions into place. We have a little bit of a focus on older adults. So we're working with dental students and dental hygiene students under our new state HRSA grant to start exploring not just public health as a topic area for students, but also why it's so important that we focus on some of our older adult populations, which tend to get ignored and overlooked, in case you guys haven't noticed. So that's a focus for us in 2023, as well as under the new HRSA grant, also doing some teledent in medical offices. Our friends at the chapter of the Academy of Pediatrics are going to be working on that. So we're really, really excited to see where that goes. So just one last kind of other plan slide, just things that we didn't necessarily mention previously, but I think are really, really important to talk about. We've been doing a really great job of collecting a lot of data. And as Allison mentioned earlier, we're going to use it. That's what we want to do in 2023. We want to take all these data that we've been collecting for the last 5 years and really start to not just share them, but use them to inform the work. So, we've done some work around collecting information on charitable work tracking. So a lot of free clinics and pop-up clinics in the state. What are they doing? How many people are they serving? Let's put that all together and talk about it. Looking at our Medicaid data, which shows us some of the disparities with our Medicaid population versus non-Medicaid population. And then, of course, keeping in mind all of those measurable outcomes and surveillance indicators from the Department of Health and the Oral Health Program. So those are data pieces we're going to be using to inform the work. We're going to continue doing all of our CDC projects, which we mentioned a little bit earlier. Workforce initiatives are going to be a very big priority, particularly looking at how we drive people into dental careers. Because we know that this is not a problem we're going to solve overnight. We know that numbers are going down, and it's going to take years to get them back up to where they need to be. So that's sort of where our focus areas are. I did want to share, these are the events we have on the calendar so far. We'll probably end up having a lot more events in 2023, but we'll be doing a workforce report out from that Part 2 report in January. We'll have some virtual stakeholder opportunities this year. So hopefully, if you're not able to always join us for an in-person meeting, you'll be able to pop on a Zoom. around some different subjects. We'll have our 2 virtual updates like we do every year, one in June, one in December. And then the very best news, it's time for our biennial summit. So every 2 years, we have a wonderful statewide PA Oral Health Summit. And we're really, really excited this year to return to a pretty amazing event. And I think I can say this, I don't think anybody will yell at me, but we're really hoping, it's always been a 2-day event, and we'd like to add sort of an extra half day as an option for folks. And we'd like to run a poverty simulation on the Wednesday before the summit in the afternoon. So if those dates are held on your calendar, add Wednesday afternoon to them. And if they're not held, put them down, because you need to be at this event. It's just amazing gathering. We usually have about 125 people there, lots of great sponsors, and we'll be sending out those opportunities soon. A lot of great content. So if you want to know everything that you could possibly know about oral health in Pennsylvania, you've got to be there. So definitely mark your calendars for that. This is just, I wanted you guys to have the quick link to our request materials page. So it is there. That way you can go right to it when you get the slides. And also just wanted to mention that we maintain an online calendar on our site. So we put our events on there, we put other people's events on there. So if you want to tell us about your event, please do. We will put it up there for you. And there'll be some other events like Mission of Mercy events, if you guys know those. Those are pop-up dental clinics. We're also really excited to see remote area medical pop-up events come to Pennsylvania this year. We've got, I think, 2 or 3 planned. So you can go to ramusa.org and see what kind of clinics they're going to be having, free clinics in Pennsylvania. And then all of our social media links are there as well. So sometimes we send things out not through our newsletter, through social media. So you can jump on there as well as support us through Amazon Smile. So I think I did talk longer than I wanted, but I did allow 3 whole minutes for questions. So if anybody has any questions, we can pop those in. Yes, great question. So is there a date established for the Advocacy Day? We are waiting. So our state legislature does not put all their session dates out right away. We have the Senate session dates, but we do not have the House session dates. So we're hoping to have those ASAP. But I'm thinking just because of planning purposes, we may have to do it in April. We were hoping to maybe do it before the budget, but I think we're looking at possibly April. And we will have that date out as soon as we get the Capitol booked and we get the House dates. And that'll be social media website. We'll put it everywhere. Any other questions? Oh, the teledentistry bill. Absolutely. Yes. So the teledent bill is interesting. It basically, it doesn't have a whole lot in it, but it basically says that we will have a definition for teledentistry and we will fund teledentistry. Because if you don't have a definition for teledentistry, people can kind of do whatever they want and call it teledent. So it's a description, and we can make sure I can add the link to that to send out so that everybody can read what the old version looked like. And then we can, we can always tweak that as it's reintroduced in the next session. Any other questions? Yes, and the recording will come out to everyone who is here today. You'll get an email with the recording, with the PDF of all the slides. So you guys will have access to all of that, and you can follow directly up with us on any questions that you have. Okay. All right. I think we are all good there. Any other last minute questions? All right, guys, I think we timed that perfectly today. So we are coming up on 1 o'clock. We will go ahead and end the webinar for now, but really looking forward to keeping in touch. Tell us what you're doing. We'll tell you what we're doing, and we'll work together in 2023. So thank you guys so much, and have a great day.